Good afternoon. Today's Friday, August 28, 2020, and I'm Terry Scoggin, CEO of Titus Regional Medical Center, and it's time for our weekly COVID-19 and Titus Regional Medical Center update. Shout out to Stormy, who I know is already watching, saw her on there. Hope you and your family are doing well and everybody's healing good. It's great to see you following us on a weekly basis, so thanks, Stormy. I want to give a shout out to a couple of things that are going on right now. We've been very appreciative over the last few months of what's being done by our county and our city officials in the council. We meet on a daily basis. There was a problem with the clicker, so I'm sorry. But I want to give a shout out to Chief Larry McCray and what he's done for our county and our community. He has been able to work with the state of Texas and the group that's doing our weekly testing, and we will be able to keep that testing over. I think it's over 2,000 tests have been done in the last few weeks on a daily basis. We're seeing somewhere between 150 and 200 tests that are being done for all counties. There's no charge. Results are coming in at a pretty decent time. Friends of mine who've had it done are getting them back fairly quickly, the texting that they're using. But the chief was able to work with and will have testing to the end of September. It's a big win for our community. Northeast Texas and especially Mount Pleasant has been through a lot in the last 5 months. So to have this resource is a huge win for us. It's a huge win for our health system, for you to benefit from it as well. So please let your friends and family know they need testing in September. The process is not too difficult. It's fairly quick, but they can go in and be tested. The gogettested.com website is the fastest way to do it and process it, so your information's in the system and you can scan things in. But take a look at that. We're excited, and that's some big wins. So, Chief, thank you. Judge Lee, thank you for your impact. And Dr. Chris Burling, our medical director for the community, thank you for your help in getting that for our community. It's been a big week at the health system. We announced last week, and we had dinner last night for all our primary care docs, part of Titus Regional Medical Group. We were excited. Dr. John Cannon, Jay, joined our health system this past Monday at the Family Care Center, Harts Bluff. Dr. Reichert's old building. Joined Dr. Brad Burrows, Talisha Coleman, and Allison Rios at the Family Care Center, Harts Bluff. And it's a beautiful facility. If you have not been in it, we'll be doing a grand opening sometime in September and October with the Chamber of Commerce. We're excited about that. But Dr. Cannon started seeing patients this week, so it's a big win to add more primary care. Primary care is a focus for our health system, making sure that we have the right number for Northeast Texas. We've been behind for many years, but over the last 5 years, we've made huge strides in adding primary care to our health system, to our medical staff, and we're starting to see quite a few of the local patients that used to go to Dallas, Tyler, and other facilities are now having their primary care done here locally, and that's best for all of us. So, Dr. Cannon, welcome. I'm glad you're part of the Titus Regional Medical team. Last few days have been nerve-wracking. If you've watched the news of Hurricane Laura, and from a health system standpoint, we watch those closely, and we have strike teams and different things that are asked of us all the time. We were asked by the state of Texas to send 2 members of our EMS crew to participate in the state's joint efforts for emergency evacuation and preparation for Hurricane Laura. Andrea Easley and John Erlano are both pictured here. They left last Sunday and have been gone for almost a week now. We just want to continue to ask you to lift them up in your prayers and think about them and their families as they're traveling. And the rest of our EMS crew who's picking up for missing 2 of our key team members this week while they're helping the rest of the state of Texas. We've gotten some information on a daily basis of some of the tasks they're doing, and they're helping people, and they've been transporting from the San Antonio area, has been their baseline, working all the way to Orange, Texas on several trips. But just want to ask you to remember them in your prayers this week as we continue to help the state of Texas and our sister hospitals and healthcare facilities down along the Gulf of Mexico. So, Andrea and John, thank you so much for that. We appreciate what you've been doing for us. As I mentioned a minute ago about the testing, from a hospital standpoint today, we have 2 COVID patients in the hospital and 1 in ICU, 2 on the floor and 1 in ICU, so 3 total. For the last 2 weeks, we've been running around 3 or 4 on a daily basis, so it's good to see. We've had a few changes come through the emergency room of COVID, but it's been light for the last few weeks, so we've been appreciative of that. Then school started. And we've been overwhelmed for the last few days. With kids going back to school and everybody getting out a little bit more, you're starting to see the increase of just testing and positives over the last few days. So would encourage everybody as we start working with the school systems and everything about kids going back, sanitize, wear your mask, social distance are critical. If you have symptoms, there's 13. Go to our website, TitusRegional.com, our COVID-19 website, and look at the 13 different symptoms. If you have any of those, please stay home. Please have your family members stay home. Please have your kids stay home. We need to mitigate and keep the spread from advancing. We've made so much progress in the last few weeks and months. We want to do our best to keep it down. So I wish the schools the best. The NTCC was on our call a few minutes ago. We had it this morning talking about the college and what's been going on this week with the students coming back. And it was great to hear some of the progress that they've made and some of the things that they've got going on. I know they spent most of the summer doing a lot of work to prepare, and it's paying off for Dr. Ryan Clinton and NTCC. So congratulations to them. All of our superintendents have done a phenomenal job, but with the increase of kids going back, we started seeing it this week. I know our friends at the Pediatric Clinic and the Family Care Center have both had a large increase in the number of same-day visits with these symptoms. So be cautious of it. If you're out in public, please wear your mask. Please social distance. If you do touch somebody or something, make sure you sanitize as quickly as possible. From our perspective, this is the end of August, and it's crazy how quick the summer's come and gone. I want to thank everybody in Mount Pleasant, Titus County, Northeast Texas, for supporting us. May was hard. June was a break. July was just crazy. Never saw anything like July in the history of the 9 years I've been here at Titus Regional Medical Center. August, we're starting to see some increases over the last few weeks. But as we start preparing for flu season, as we start working through school going back, we ask for your help. We ask for your support, support of this health system, support of this community as we continue to work together to fight COVID-19 and mitigate the spread. Thank you for all you do. God bless.